After a long day on our feet, most of us feel some aches and pains, but for people who suffer from varicose veins, the bulging, throbbing veins can make standing for more than a few minutes very painful. In the past, treatment included hospitalization, a procedure called vein stripping, and a long recovery. But now there's a new, less invasive procedure that takes care of those bothersome veins and gets you back on your feet the same day. It's called endovenous vein laser treatment.
You can see the laser light underneath the skin. And what this is doing is damaging the lining of the vein, and it causes the vein to collapse on itself.
Join us tonight on News Center 16 at 11 for a special medical moment. We'll take you inside a Mishawaka doctor's office where a laser is giving people a leg up on veins with no stitches.
Varicose veins are swollen, twisted, and if you have them, you know they can be painful. More than 25 million Americans suffer with varicose veins, and getting rid of them used to mean vein stripping, time in the hospital, and weeks of recovery. But what if we told you a laser procedure could give you a leg up on veins and put you right back on your feet? Maureen tells us how in tonight's special medical moment.
I've had tremendous discomfort in my legs, varicose veins, for several years. My legs would swell. I had an aching, tired, heavy feeling in my legs.
62-year-old Judith Lindsay of South Bend is a small business owner and can't afford to be off her feet. That's why 4 weeks after having a laser procedure to get rid of varicose veins in one leg, she's back at the Legacy Vein Clinic to have her other leg done.
Okay, the first thing we're going to do here is mark some of her bulging veins here.
Dr. Michael Lelensky says Judith's veins are minimal, but the clinic has done endovenous laser treatment on more than 2,000 legs, and the before and after pictures show what a stunning difference the laser treatment makes. Judith got a little Valium to relax her, and then the procedure gets underway. Dr. Lelensky uses ultrasound to guide him.
The round black dot that you see there in the middle of the screen, that's actually what's called the greater saphenous vein, and that's the vein that's causing all the problems.
Problems like pain and bulging caused by a backward flow of blood due to failed valves.
Well, what we're doing today is we're going to be making a little tiny nick about 2 to 3 millimeters in length. The first thing we're going to do is numb up the skin. So the patient's going to feel a little tiny needle stick here.
So far, so good.
I feel great. I feel wonderful.
Then a small sheath is put in to guide the laser to the right spot, and lidocaine is injected.
This is actually the most important part of the procedure, is surrounding this vein with enough lidocaine to make it comfortable for the patient and also to collapse the vein around the catheter.
Now it's time for the laser.
You can see the laser light underneath the skin. And what this is doing is damaging the lining of the vein, and it causes the vein to collapse on itself.
Over time, that bulging, painful vein will become a thin thread of scar tissue. And almost as quickly as the procedure began,
and that's essentially it. The laser is done.
Having ablated the saphenous vein, all that's left to do is remove the bulging veins.
It requires numbing the skin up over the varicose veins, making little tiny incisions that do not even need stitches.
Judith gets compression socks she'll wear for 2 weeks, but other than that, she's back on her feet. And after having the traditional stripping years back, both she and the doctors say there's no comparison.
The old surgical procedure required general anesthesia. Oftentimes it was done in the operating room, had large incisions, numerous stitches.
And while Judith will have to elevate her feet off and on for a couple of days, she was back on her feet in less than an hour.
This was absolutely painless. Absolutely painless.
Maureen McFadden, News Center 16.
Now, the laser vein treatment is covered by insurance since varicose veins stem from a medical condition. Dr. Lelensky says the cosmetic improvement is just a bonus. And if you'd like more information on the procedure, just go to our website and click on Mo's Medical Moment.